Welcome to Generous Impact. This is Brett Brummett.
And my name is Amanda Brummett. We are joined today by two amazing people from Sagebrush Health, Jami Dybik, Vice President, and Rodbel Rodriguez, Director of Community Engagement. In this episode, you'll hear how they are preventing and treating sexually transmitted infections at no cost to patients. They are in the community, breaking barriers, spreading awareness, and preventing infections through testing. And they offer extensive treatment at no cost to patients. I think you'll be inspired at their aim to eliminate new infections. Well, Jami and Rodbel, thank you both so much for making the time to be here with us today. I would love to start with you sharing with our guests just who you are, both personally and professionally.
Oh, great. So my name is Jami Dybik. I have been in the healthcare field for more than 20 years. I became passionate about community health about 8 years ago when I opened a medical clinic in South Carolina. And that clinic was focused mostly on medical care for people living with HIV. We also had a prevention wing that we did prevention for STIs and HIV in that wing. We had mental health for those folks. And I started to see really that there was a need for education, and that lack of education that people had around how STIs were spread, how they could protect themselves from STIs and HIV. That was really something that was lacking in our society. That was not something that we talked about. We didn't talk about sexual health. We didn't talk about how you could protect yourselves. People thought that if they were married, that in and of itself was a protection. It didn't apply to them. And we really had to start educating people on the fact that, STIs you can contract HIV and Hep C through other means other than just sex. And so therefore, if you had sex with your married partner, then you could then transmit that to your married, spouse. And so there was a lot of education still to be had. And since sex wasn't talked about, or it's very, very taboo to talk about sex, that education piece was really, really lacking. So I became very, very passionate about that and started really getting more involved in that in my career. So that's a lot about my background.
And Rodbel?
Hello, good morning. I'm Rodbel. I have been doing healthcare for over 12 years. My passion began in 2011. I got a job right out of school. It was at an HIV practice in Phoenix, Arizona. And I remember when I came in on board, I had a lot of fear, right? HIV was very different back then than what it is now. And the education and resources were not as available as they were. So I remember I took the job mainly because I needed the job. And I started working there, and I used to be terrified. By little, I started educating myself, and I learned the need that there was in the community and the change that us could do, the positive impact that we could have on the other end. I feel like that changed my mind big time. And working with such a great team at the time, it opened my eyes. This is not what you hear about. This is not what people tell you, what you see on the movies or what's on TV. And since then, like, something sparked inside of me, and I was like, okay, I think I found my path. This is where I want to be, and ever since I've been involved in the field. I've been with Sagebrush 2 years, and it has been an amazing journey with the company, because without being able to do what we do and provide the services that we do, it's been very rewarding. And I feel like I've continued that path that I took since it was like I took an oath, like, let's make a change, let's make an impact, and here we are. So I'm now in Las Vegas. I've been in Las Vegas for 4 years. I was up in Salt Lake before, and in Phoenix before that. So I've been around a few states, just trying to make the same positive impact in different communities.
Incredible. I love that you both shared about both the fear of sort of the unknown and just education and learning, and things are a lot less scary when we understand them. So, Jami, I want to ask you before we get too far into the show, I am all for normalizing sexual health, reproductive health, and I just want to know, are there any tips you can give us, languages we should or shouldn't use, or anything like that to help navigate that path?
Yeah, I mean, we have talked about mental health, is a big one we talk about now. It's very normal. There's a lot of education now around about mental health and normalizing that conversation. And that didn't used to be the case a long time ago. Talking about your mental health was very, very taboo. That wasn't something that anybody wanted to talk about. They didn't want to share that. To say that you were struggling mentally was not something people shared. And now that's not the case. It's very normal. People will talk about their mental health. It's encouraged for you to talk about your mental health. It's something when you go to your doctor's office, they will ask you, if you're struggling with that. And that is just part of normal healthcare now. And it's not the case with your sexual health. It's still very taboo. It's taboo to talk about sex. And it shouldn't be that way. So I think that normalizing that conversation is something that we really need to continue to talk about. I think it's something that we should normalize in our healthcare fields. When young people go in to have just a normal appointment, I think it's something that they should feel safe talking with their providers about. We see now a little bit more, it's becoming, the conversation about HIV is a little bit more, accepted in society where, people will come out and they'll say, celebrities especially, I've been living with HIV, and you have them, out there in the forefront kind of paving that way. But you don't see young girls stand up and say, I've struggled with gonorrhea or chlamydia. That's not something that they'll be willing to say. But in our society, I don't think people understand that in some areas of the United States, a lot of young men won't wear a condom. They won't wear a condom when they have sex with women. And so these women are struggling with getting these STIs and having to go in and get treated for them because they're not educated in the fact that there's actually female condoms out there and they can protect themselves. So there's a lot of education that's lacking. And just because we're not willing to talk about it, we're not willing, as even providers are nervous about talking about it with their patients, because again, sex is not something that we've been willing to talk about and normalize in our society. So I think maybe instead of talking about sex, it should be more like sexual health. Like, let's talk about your sexual health. We don't need to know about your sex life. That's private, that's personal. Whatever you're doing in your sex life is fine. We want to talk about your sexual health. We want to make sure you're protected. We want to make sure you're safe. We want to, do you understand what you can do to protect yourself? So whatever you're doing is completely your business, but we want to provide you with the tools that can protect you so that you don't have to worry about, going out and contracting something that maybe in the long run, we can't give you that will clear it up, right? You'll be living with this forever. So I think that's more of the conversation we should be having, not just with the community and, and people in the community, but also our healthcare providers, and being willing to bring that up more with their patients and not being scared to do that.
Oh, for sure. I think a lot of people don't realize that their healthcare provider is the perfect person to talk to about that. Mm-hmm. And it's a safe place to talk about it.
Yeah. Especially with, and not just with the young folks, but also, our 55 and older population, the fact that people, assume maybe that sex is not happening amongst that population, and it is. And that population didn't get education, even more so didn't get education, at their young age. And they are, they think, well, I'm not going to get pregnant, so I don't need to use protection. There's that out there. Their divorce rates are higher than ever. So they're having more sexual partners. There's a lot that goes on that we need to start thinking about and having that conversation and bringing that back, into our healthcare settings where we can have that conversation with those people openly, it not be taboo anymore, and that be okay, and just say, hey, whatever you're doing is fine. And we're not here to judge that. There's nothing judgmental about that, but we want to educate you so that you're protected.
That is, it's a big lift, especially thinking, how the provider-patient relationship maybe isn't the best state it's been in the last couple decades, with changing and aging out of providers or changing healthcare system. So thank you for doing that and really starting to help promote that amongst the providers.
Yeah, of course.
Yeah.
And it's again, like you said, it's a kind of a let's get in and get out of those appointments. People are having to, it's very hard to get in with a provider now, and the providers are packed with their patients and their days are packed. And so they're just trying to get through, each patient. And so just to take that extra time and just say, hey, just want to also bring this up and just make sure, is there anything you need? We have condoms here. Is there anything you want to talk about? A lot of STIs are asymptomatic. If you're sexually active, would you like a test? Would you like a free test? There's some things that we can do to just make sure that people have access to things that they should have access to. Sexual health should be free to have access to sexual health
Without a doubt.
services.
Yeah. And that's a perfect catalyst, because I'm going to switch the tables and Rodbel's going to pull you in and kind of talk through Sagebrush Health and find out if there was a catalyst or set of events that prompted the creation of Sagebrush's mission to improve sexual health.
So Sagebrush Health started in 2020. We started with a rheumatology practice, and we started developing from there, from rheumatology to neurology to primary care. And I think the focus started mainly when leadership started noticing the lack of care and the need in the community for in certain areas. And the vision that the leadership had at that time was great, because they seen a need and they jumped into action. So ever since the company started, we were looking for ways. How can we improve the community work? Where can we come in and make a change? Where is there a need? And we're making that happen. With the services that we're providing right now, I feel like we're keeping our promise to our community that we're here. We created a safe space for people to come in. As Jamie mentioned, most people have sex, right? Sex is a very natural thing. So we came in and we wanted to change the way the people will look at it, right? You go to your doctor when you have diabetes or when you have high blood pressure, and you discuss that. You discuss your symptoms. How are you feeling? Your medications. Do you need treatment? And there was a lack of sexual health providers or like places that will make you feel comfortable or welcome, or and we were also able to create a network of community partners that had been a great support system, because ultimately, like I mentioned, our goal and our promise to the community was like, we're here, we got you, we've got you covered, right? And it was mainly that, like when we seen the lack of care and the high need for the community, that's when we decided to take action, and it's been working out. We made a very impactful change in the community, and it's not always just showing up and providing testing or treatment. It's a lot of the time is providing information, right? Resources and educating the community really has taken us a long way.
That's incredible. Yeah, I love that your physicians saw a need in the community that wasn't even in their specialty and said, you know what, let's do this. Let's figure out how to fix that. It's a great story and says a lot for the providers that you guys have at Sagebrush. Well, let's get into the details of your program. Jami, I'd love for you to explain to our listeners exactly what you guys do. And it amazes me as I look at your scope and everything that you do for free with community education and testing, pre and post exposure medication, sexual assault services, harm reduction services, incarcerated population, STI testing, like hitting on all these things that we need. Can you tell us about the program and how it works and how you guys managed to do all of this?
Yeah. So, well, I mean, I give a lot of credit to Rodbel and his team, of course, for all of that. I mean, a lot of those services are set up by him and his amazing team. And you touched on a lot of them. A big part of what we do too is we realize that there's a huge stigma out there for people going in to get tested at the, STD clinic. To do that is a big thing for people. They don't want to walk in, to a clinic and get tested, or there's fear in that. There's fear around walking in, to get that testing for a variety of reasons. Right. And so, a big thing that we started doing was going to their point of care, offering that service where they're already going in to get care, going in to receive, services in their specialty care and their primary care clinic, with their doctor. So we've partnered with a lot of area specialties and specialty doctors, and we are providing those services in their clinic where the patients are already going in to get services. They're already feeling comfortable. And we're providing those screenings. Hey, we're giving them something saying, we are providing these services. Could you be at risk for any of these STIs? Would you like, a free test? Here are the services that we provide, and it's confidential. We're able to, if you don't want to do it there, you don't want to go, get your blood drawn. You don't want to have a test, an instant test. That's fine. If you want to do it in the privacy of your own home, we will drop ship you a test in your house, and you can self-administer that test. You can send it off. The results will come in, and we will, if they're positive for anything, we will treat you for free. And it can be all confidential and in, again, the privacy of your own home. So we've tried to create some different angles to make people feel very, very comfortable. And the goal is, of course, to give access to as many people as possible, because access is one of the biggest struggles we've seen, is that, people either don't have access to treatment or prevention services, for a number of reasons, right? They don't have transportation, or they don't have, or it's stigma, for a variety of reasons. So we're trying to make access a big key element here, where we will send it to you. We will do whatever we need to do to make sure that you can get tested, you can get treated. If you want prevention, like we said, with the prevention of HIV, the PrEP services, we can do that. We can make sure that you get those services. They're free. You can give us a call. We can make sure they're mailed to your house. We can do a telehealth visit if you're unable to get to our offices. That's also provided. We do PEP services. If you've been exposed to HIV, and if there is within a 72-hour time frame, if you get a hold of our offices, we can make sure that you can get prevention services that way, to try and prevent HIV in that manner. Like you talked about, we do have some harm reduction services that we're involved in. There's a lot of things that we're trying to do to make sure that access to all of our services are available. And so we have scaled that as much as we can. We're in Reno now, so we're doing that and growing that out of Reno. We're just really trying to make sure that we can reach as many people as possible with as much as we can.
So impressive.
Yeah.
So, Rodbel, since you first started the programs and with your team, have you seen where have you seen the biggest impacts, and are those different than what you thought they would be?
So one of the biggest impacts that I've noticed lately within the last few months, besides HIV care and STD care, something that we notice is that syphilis itself is on the rise, and there is a shortage of treatment. Like Bicillin has been back order for a while. It is kind of hard to get. We were lucky enough to be able to have enough inventory to be helping out the community, especially because syphilis is also on the rise on pregnant women, and that is crucial, right? So making that change and being able to provide that service and have that positive impact on somebody that is going to deliver in 2 weeks, in 4 weeks, in 6 weeks, or maybe somebody that came in randomly for a test, and they so happen to be positive for syphilis. And with us being able to treat you right then and then at the moment, and making that change, I feel like that'd be very, very impactful in the community, because we are able to treat you, to test you, and to keep on going. for you to have a healthy delivery and no complications during delivery. I feel like that has been one of the biggest impacts lately that I have noticed in the community.
Yeah, and just to piggyback off of what Rodbel says, if I can, syphilis is incredibly expensive to treat normally if you don't have insurance. Even with insurance, it's incredibly expensive to treat. But with our program, if you do not have insurance, we can treat you for free. So if you, or if you're underinsured, please come and see us, because we have this program set up to where we will treat you. We do not want you to feel like, there's no option to get treated, especially if you're a pregnant woman. It's detrimental to a child in utero if you are a woman and you're pregnant and you have syphilis. So please come and see us, because we can make sure that you're treated. And it's free of charge. We will not charge you anything for that treatment. So that is one of the most proud things that I am about our program, is that we can treat syphilis for free.
Incredible. So you guys have all these things in place to remove barriers, the telehealth, the shipping to people's homes. One of the most brilliant things that I think you guys do is the rapid testing on site at Walmart, at nightclubs, at consulates, at the gym, literally meeting people where you are, or where they are, rather. So are you able to share a success story from that?
That's a really good question. Rodbel set all of that up. And so that is actually amazing that he did that. So
when we started like developing the program, we were thinking outside the box, right? We like Jami mentioned, we have an amazing team. It's a big group of people that we all work together to make this happen. And usually we're pitching in like, what do you think? Where should we go? How do we make this more accessible to people? And that's where the idea started of, let's go to the consulate, let's go to the gym, let's be present at places where you can think of, right? Because sometimes you show up to a pharmacy or a health center and they're doing free screenings for diabetes, free screenings for your blood pressure or cholesterol, and there was something missing. And that's where we came in and we changed that. So being able to provide services at random places where you're actually not expecting it has been very rewarding, because people actually want to get tested and people want to learn and they want to know more about it. And again, like I feel like the numbers of people of patients that are on PrEP now, based on these events and this outreach, has been going up, which is it's a great thing, because PrEP is an amazing preventative measure for HIV, and the impact that we've had in the community by being present and by testing people at places has been great.
I think PrEP is one of those things too that I think a lot of people think is only for gay men, and it's not. So PrEP is for anyone. Really, what we always say is, if you're having sex, PrEP is something you should consider, because it prevents HIV, and so if you're having sex, that's something that is something you should think about.
And how long has PrEP been around? Because I've actually only seen it advertised or made aware of in the last 2 to 3 years.
Yeah, I think that PrEP's been around, and Rodbel could probably speak to this a lot more. I mean, we've been doing PrEP since I was in my clinic back for at least 8 years ago. So I think it just, with all the advertising, it's become more prevalent and available. But I mean, Rodbel might be able to speak to it a little bit better than I can from that standpoint.
So PrEP started being available around 2012 in the market. At that point, there was only one option, and it was a great option. It was a new treatment. It was a new preventative measure, and I feel like it changed the game for the good. Fast forward a few years, we now have 3 different options. We have 2 oral medications that are taken daily and an injection that's taken biweekly. And as Jami mentioned, PrEP is not only available, or it wasn't only intended for the LGBT community. It is also available for women and for straight men. There is an option for everybody, and it reduces the risk by 99% in contracting HIV, and it reduces the the risk of contracting HIV by 74% in people that uses IV drugs, and so PrEP is it's an amazing thing. It's one of the greatest tools that we have available as a preventive measure, and that is one of the services that we offer for free at Sagebrush to everybody, insured, uninsured. It doesn't matter where you come from. What your immigration status. I feel like that is something that it's also worth mentioning. A lot of people that doesn't have a legal status, or in the U.S. think that, oh, because I don't have a status, I can go to the doctor, or I can get treated, or I can go get seen. We don't look at none of that. I feel like when we wanted to make a change and when we wanted to have an impact on the community, that was for everybody. It was across the board. And so that is not something that stops us from caring for somebody. And people shouldn't think that because you don't have a status, you're not able to receive the care. There is options available for everybody. And that was one of the biggest reason that we wanted to reach out to, per se, in this case, the Mexican consulate or the Salvadorian consulate, because with me being Latino, I knew that there was a lack of education in these specific topics, and of a legal status or because of a language barrier, that we're not able to go somewhere and receive this care. And we're changing that as well. We're here, we're present, and a status does not stop you from receiving care or from receiving treatment. We're here for everybody.
That is so amazing. I just kind of want to stop and celebrate you guys, but I can't right now. So keep going. Jami, with the success that Sagebrush is having and the day-to-day impact on the community, how do you ensure that the impact you're having today will have the longevity it needs? And what do you think you'll define the Sagebrush legacy as?
I think that to try and continue is a big conversation we continue to have. We need support from, the community, our community partners. That's a big one. We look constantly towards who can we partner with, how can we continue the outreach that we're doing, where is the need the greatest. I think that is the biggest conversation that we're always talking about is, if there's a need, how can we get to that? And then who, if we need to, do we partner with in order to make that successful? So, in order for longevity, we can't do it alone. We've got to have a partner. We've got to have, that partnership to continue to progress. I think for our legacy, I definitely want to continue to spread outside of Nevada. That is my goal, at least. Personally, I hopefully can speak for the organization. HIV, Hep C, STIs, they don't know any color. They don't know any gender. They don't know any economic status. They don't know any state specific. They are country. I mean, they're just, it's everywhere. And so, Sagebrush is growing, and I think that our outreach should grow with it. And we should not just stay in one place. I think that we should continue to grow. And that is my hope, is that we eventually will be in all 50 states and be able to provide these services. I think that sexual health care should be free for everybody. And I think these services should be free for everybody. I think if we're going to try and help eliminate the spread of HIV, I think if we're going to help try and educate people, it can't just be in one location. I think we have to be able to partner with everybody and continue to move outside of our spaces. So that's my goal and hope. But, crawl, walk, run. So we're doing that one step at a time.
Jami, that is a beautiful goal and legacy. And I have to say, just as we've been talking this morning, it keeps going through my head. This is a public health issue. Mm-hmm. This isn't a Nevada issue. This isn't even an STI issue. It's a public health issue. And you guys are treating people with dignity and allowing them to get the care they need. So I hope that your goal comes true and that 20 years from now, we're not talking about this because this is just something you go down to the corner, health department or wherever, anywhere maybe, and get it taken care of. So I hope you guys inspire that to spread.
Thank you. I appreciate that.
Yeah. So Rodbel, while we're talking about big lofty goals, what's next for Sagebrush Health?
What's next for Sagebrush Health? I think like Jamie mentioned, our goal is to start expanding and being able to reach out communities where there's a lack of care. There is a lack of care everywhere. There is a need everywhere, but there are specific communities that need it the most. And I feel like our goal, like Jamie said, is that it's get out of Nevada and expand as much as we can and just being able to reach out communities and making a powerful change, an impact, and offering these services and just normalizing sexual health. And I feel like normalizing sexual health and just talking about it like we talk about anything else will reduce the stigma and it will reduce HIV and STD rates just as much as treatment and PrEP and other prevention measures that we have. So our goal is that just to expand and to be able to provide these services to every community and to ensure that there is not a shortage of a provider that can prescribe your HIV treatment and that you have somebody that you can go in and talk about syphilis and be like, I think this might be, I had an exposure, I had a high risk and it's normal, right? Like we talk about normal and our goal is for us to be able to do that here in Nevada, but then also in Connecticut and South Carolina and Pennsylvania, like you name it. I feel like that is next for Sagebrush and I can see that happening in the near future because we're in the right path. And just like Jamie mentioned as well, we couldn't do this alone. And just creating this relationship with community partners and people that does what we do or that offers some sort of services, it is crucial because we cannot do it alone and it takes a village. And here in Nevada, we have a village. We have amazing community partners that if I can help you with this, I'll send you, I'll connect you to somebody that can. I know who can do this. Like, let me take you over. Let me send you over. So we want to create this network in different states so that we are able to offer the services that we offer here in Nevada everywhere, and so that we are an option for everybody across the country.
It's so fantastic and so inspiring, and I hope you get to replicate as often as possible, just for the greater good. And it's inspiring. So that leads me to the big kind of warm fuzzy question. You guys are inspiring to us. Who or what organizations or what people are inspiring to you guys currently that you feed and draw from? Jamie, I'll let you take off.
Yeah. There's a lot of course, organizations that inspire me. I will say from an individual aspect, I am constantly inspired by case managers and our care coordinators especially, but care coordinators and case managers, people that do the testing, do the testing and then care for, the folks that are positive, especially for HIV. That is really who inspire me. It takes a really certain kind of person to deliver that news to a person, that they are positive, and then to take on that care, case management, care coordinator, job to get them into care, to walk them through that step of, moving into that life and caring for them because they follow that person and make sure that they are then, that they're getting the care that they need. So that I see them do it every day. I see them take care of patients. I see them, coordinate that care with providers, getting them, into the medications that they need. But really, it's just that testing and watching them do that day in and day out. That's a really tough job, and they do it with compassion, and they do it with sensitivity, and they do it without judgment, and they do it, in areas that they go down and they will test, the homeless population. They will test IV drug users. They will go into areas that, maybe not the safest areas that you would think of. They go and they go out in rural communities. They make themselves accessible to the community to do testing, and they are really incredible. And so I definitely inspired by them every day.
So Rodbel, Jami took all the case managers off the chart. You can't name them now. So where do you draw your inspiration from?
I like to get inspiration everywhere I go. Like, for example, if I show up into a clinic and I'm helping with something, I just love to hear the way our providers, our MAs, our front desk, our team talks to people. But then if I go to a different clinic, we work really closely with the health department here in Southern Nevada, and showing up and just seeing everything that they do, from the door all the way to the back, it's inspiring because this is the kind of job and the kind of field that you have to do it because you love what you do. You cannot force it. There is a lot of information. There is a lot of constant changes. There is a lot of people that comes in through the doors. So you really, really have to love what you do, and seeing people loving what they do and showing that to the patients and the way that they care and treat them, that is very inspiring. The way that you walk them by and you talk to them and you tell them, like, you'll be okay. We've got you. We're here. We're here to help. I find inspiration on that, and how our community partners and our team and everybody treats our patients, from the moment they show up until the moment they leave. That is very inspiring because, again, it takes love for us to do what we do, because it is a very challenging field. It is a constant change. It is constant new information that we have to receive and to provide, and just being present and being part of the field. I feel like that's already inspiring as is.
Very cool. Is there anything that our community, our listeners, our support can do for your organization?
I think definitely, spreading the word about just, where the services are provided. If anybody is in need of testing, if services of prevention services, education, just knowing that we're there, that we have those available, and just also helping with the just education themselves and awareness. Awareness is huge. Stigma still is here. People think, HIV is still, if someone has HIV or even an STI in general, that there's something dirty about that, or there's something, there's some sort of there's still a stigma around that with someone, that there's something wrong with that person. And it's a really, it wraps around the whole lack of awareness. And I think just educating yourself, helping educate the community, it would bring a different aspect in general, to our world, and, as a whole, about STIs, HIV, and how that is affecting our population, of sexual health, and how that is the spread of that could probably diminish greatly if we just had a little bit more awareness.
So spread the awareness.
Spread the awareness.
And we'll stop some spread the mystery. Right. Perfect.
That's right.
Thank you, guys.
Wow, I'm beyond impressed by the way that Sagebrush Health is approaching sexual health with dignity, professionalism, and education. We wish them much success, so much that maybe they can work themselves out of a job. If you want to learn more, you can find them at sagebrushhealthcare.org.